look like a handshake, right? We have a lot of strength if we're together, but when we separate, we don't have a lot of power here.
Right.
Right? We can't. If I had to lift you up, I wouldn't have a tough time with this level of contact.
Right.
Versus, okay, now I got you. Hello, my honey. Hello, my baby. Hello, my ragtime girl. Send me a kiss by water. Baby, my heart's on fire. If you refuse me, honey, you lose me, and then I'll be left alone. Oh, baby, telephone, tell me I'm your own. My wife's like, really, Ed?
I think the main, where this all started was a rugby accident when I was about 19.
Okay.
And I had my head knocked down really hard. And I went to an orthopedic surgeon like 2 months or 3 months after, and he said, it looks like it's fused back together. He said, if I caught it earlier, I would have gone in and be able to fix it, but it's fused back. And I was fine until I was 38 years old. And I did a lot of travel and wearing a lot of heavy backpacks. And I think I think it was a CrossFit accident where I pulled a muscle in my back. And from there, things just cascaded. It started in the upper back and the neck, very tight, very sore. And over the past 4 years, it's slowly moved down. And now my hips, very sore, side.
So it's like if you have a car and you have a new car and you hit a curb, you have the damage that hitting the curb caused to your wheels, and then you have the alignment issue that now that trauma put your tires out of alignment, and then you go drive your car. So you have a rugby injury where you get flexed deeply. That tears the ligaments on the backside. So essentially your head doesn't want to come back upright.
Yes.
Because the rubber bands back here won't pull you back upright.
Right.
Now, that puts a lot of stress on the joints. That's what hopefully he means that the joints are still together. I'm going to translate that. But basically that there's no dislocated vertebrae. But there's a lot of stress put on the disc in doing that. And so they were doing a treatment. Can you be a little more specific? What were they doing? You've been going through...
The orthospinologist.
Please.
So I was going to a physiotherapist for about 9 months, and he couldn't find the genesis of the problem, no joint problem or anything, and he referred me to this orthospinologist. And they kind of explained it, head as a bowling ball, and the weight was just being, put down in a not the ideal manner. And so the orthospinologist, their technique was I would go in twice a week, lie on my side, and they had a little hammer, and they would just try to tap it back into place.
Right.
And it didn't.
Right. When you have a disc injury, it's like a jelly donut. The jelly actually doesn't want to be outside of where it wants to be. It's supposed to be in here in the center core. If this is so pressurized on the front, the jelly will start to go out of place and go back here. And there's no manipulating. It was hypermobility. It was over mechanical utilization, which injured the disc in the first place. So any treatment on this area isn't going to, it's not like you can just push that back in if this stays compressed. The only way to get the disc to go back in is to restore the curve, called the lordosis, which unweights the front part of the disc. And actually the disc will we call it a vacuum effect. It'll actually go back towards the front once you unpressurize the place it wants to be.
Sure.
So when you have a injury, I'm going to use this just because it's bigger and it's easier to see, but when you injure the spine in a flexion type injury, the joints have the most feeling. So the knuckles in our spine are on the back, and then there's ligaments that hold this all together, and you tear these ligaments in a deep flexion. So the rubber bands they look like a handshake, right? We have a lot of strength if we're together, but when we separate, we don't have a lot of power here.
Right.
We can't. If I had to lift you up, I wouldn't have a tough time with this level of contact.
Right.
Versus, okay, now I got you.
Right.
So that's what I think what he was trying to say was fused back together. He was saying that the joints haven't totally separated. You understand?
Yes.
That they're still together. But when you bend forward, do you see how the hands kind of separate here?
Right.
And there's a rubber band that this model doesn't have that would prevent that from overstepping and getting out of place. You tear that. You've torn it. It's like a piece of fabric. It's I'm going to use this blue towel as an analogy of a piece of fabric, right? It gets, if you pull on this, it eventually, say tears, right?
Right.
And so that's an injury. And your body now, over a period of time, is going to put some Well, hopefully it closes the wound. Hopefully, which many times we don't, after you have a whiplash, you want to close that wound.
Right.
Like if you had a cut on your skin, you don't want it to heal gaped. Now you have a big scar.
Right.
So most likely it didn't heal like that with the scar there. It healed like that with like a patch.
Right. So
Does that make
scar
sense?
tissue that kind of.
So now you have so now the actual ligament's longer than it's supposed to be, right?
Right.
Because now you have this extra material in here. So now there's an instability essentially because the fabric is now overall longer.
Yeah. Yes.
Because you have this tight scar tissue. And then what can happen is if you have further injury, so it fills in with a patch, and then you tear it where the scar meets the normal tissue. And this is how scars grow.
Right.
You know, it'll heal, and then you'll tear right next to it, and then you tear right next to it, and you start getting this growth of the scar. Anyway, so
would it be degeneration of it? That's what.
Degeneration is the word the medical and chiropractic world uses. I don't necessarily agree with the word degeneration because the bones are growing. When you overwork a joint, the joint will grow.
Right.
When you overwork a muscle, mine didn't do too good, but some guys, right, they lift a lot of weights and they grow real big. If you abuse your skin, you get a callus, right? Your skin gets thicker. And so when you overwork a joint and it grows, they term that degenerative joint disease. Osteoarthritis is the medical and chiropractic term for that. My point is, if you call a bone getting bigger a disease, you have to call a muscle getting bigger a disease.
Right.
Or a callus on your skin a disease, which
Right.
they don't.
Right.
So therefore, it's like you're not being fair across the board here. They're all adaptations to stress. I call it regenerative joint adaptation, and somebody's going to copyright that. That's mine. The joint is regenerating, and it's an adaptive process, not a degenerative process. It's not a disease process. The body purposefully grows the joint. The joint's handling double the stress, so it says, I have to be double the size.
Right.
So what happens is calcium and bone spurs, these bones all start to grow larger to try to beat themselves up to handle more mechanical stress.
Right.
And there's an instability, so you tear, going back to what I was saying, so you have a flexion injury, you tear this ligament. Do you see how this fabric is now longer?
Yeah.
This is now compressed more on the front.
Right.
Because this won't come together right now. It won't come together back here, right? Because, well, you're probably, and you could have dented these joints, in the neck. You're saying there could be damage to the joint, and so
Yeah.
your body, oh, no thank you.
Yeah.
Something hurts back
Yeah.
there.
Yeah.
So any manipulation of the damaged area I've never found to be beneficial. And my dad did that for about 10, 15 years. In the beginning of my dad's practice, he would go in there and try to work on the areas. Limited benefit, I would believe, long term. We've got to get the lordosis, which is these arches back to your lower back and to
Yeah.
your neck. Your neck is supposed to be curved.
Right.
And when we bring your head back upright, I want it to occur in an uninjured area, the upper neck. So typically everybody injures their lower neck.
Yeah.
Everybody has injuries down here, and we very rarely see any injuries to the upper
Sure.
cervical. So when I'm working on your neck, I'm not even going to touch your lower neck. I have no desire to adjust the lower neck. I don't find it beneficial to manipulate an area that's already moving too much.
Yeah.
The goal is to balance your
Yeah.
spine. So to leave those areas alone and to just focus on the tight ones. Your skull sits on a round donut called an atlas. And the top two bones we gave names, your atlas and your axis, are the top two, and that sits on a pin. And this model does a pretty good job of showing limited ability for these guys to twist until you get up to this top guy.
Yes, right.
He's pretty mobile.
Right.
And there's no disc. The first disc is right there at C2, below the second vertebrae is your first disc. The axis, the atlantoaxial joint, has no disc between it.
Right.
And there's no disc between the occipital condyles and your atlas. So it's designed this way to be able to rotate very easily. When your head goes forward, having an injury like you said, and then you drove a long period of time, you injure the joints, your head goes forward, the upper neck becomes stiff, and then your lower neck becomes your primary way of moving your neck.
Sure.
And then you actually recruit your upper back. So your upper back, my joke was Larry King, when Larry King would turn his neck, he didn't turn his neck, he would,
Yeah, right.
right? So
Right.
what am I doing? I'm using my shoulders to help me turn my body, right? Instead of just turning your neck when you need to turn, people will, well, see, my range of motion is fine. Well, no, it's not. And then you'll torment the ribs. So these upper back rib heads will get all inflamed because they're not really designed to turn your neck.
Yes.
These
yeah.
guys are designed to, for your thoracic cage, but you'll recruit your upper back to assist in cervical range of motion if your upper neck is stiff, which is 60% of the work of your neck is supposed to happen up here, and that's where we have to focus. And nobody was targeting your upper neck; they were targeting the symptom area.
Yes.
Which I don't. It's hypermobile. It's injured. It's a cut. You have in X-rays. Don't get me started. You know, if we were to have any ability to see this, it would have to be an MRI.
Right.
Magnetic resonance imaging gives us some capability of seeing the ligaments and the soft tissue blurry, but at least you have on X-ray you have no ability. You can, if we see shifts, we can guess that the ligaments are injured, right? So we have these things called anterior and retrolesthesis, where the vertebrae can slide on each other. They shouldn't. When you bend your head back and forth, they should always stay lined up.
Right.
So sometimes they'll do a thing called a flexion extension X-ray. So they may have taken a picture of you like this.
Yeah.
And then taken a picture of you like this.
Yeah.
And what they're checking for is ligament instability, right? So if we take a picture like this and the vertebrae slides forward and then we hold you back. Now, what we see 90% of the time is when we bring the head back, that reduces. So the ligament is stretched and torn and shown the injury when you flex. So the correction is right there on the X-ray. Do you see?
Yeah.
If this reduces it, that's what we have to restore.
Right.
They're almost proving my point, which is, do you see how the injury reduces when there's a curve in your neck? If the curve was in the neck all the time, there wouldn't be an injury, or at least it wouldn't matter as much.
They said it was the C4, C5. That's where the kind of area, and it makes sense what you're saying because, I mean, it's a lot of the upper sort of shoulders, but a lot of tension in this area, which is kind of, it feeds down into the back and lower back. But I've also done the McKenzie method, trying to, I haven't done it in a while, but to, just push back.
I understand.
And up. But the hard thing is it done MRIs, done X-rays, and physiotherapists for a long time, but no one can isolate. It's
any active exercises are just going to involve whatever parts of your back are working, right? If a part of your back is stiff, meaning the joints have calcium, crystals, sandpaper in them, when you do an active exercise, those areas aren't functioning. They're not participating. You're just bending where you've been bending.
Right.
So that's dangerous a little bit because you're further aggravating the parts that are already aggravated.
Right.
Yes, I do want your head back. I'm not denying that. And yes, your head's a bowling ball. And yes, it needs to be over your shoulders, but we can't change it through adjustments. That took 102 years for chiropractors. I call it the iPhone update that came out in 1997, where chiropractic biophysics published enough research to show that postures only changed in the same way that it was made worse, which is stretching. Time spent in a position, coupled with injuries. So injuries, and then we call it antalgia. We heal avoiding, and then we sit in a car, and then we heal in the wrong posture, and that becomes our new posture.
Yeah.
So today's treatment's going to be kind of how willing some of these frozen areas are to being adjusted, and Ed, that doesn't feel good, or Ed, you can keep going deeper, and so I'm examining and treating at the same time as I'm working on you, seeing how reluctant or willing these areas are to function.
Sure.
Your left shoulder is low by at least, I would say, 3/4 of an inch, maybe an inch. That this left shoulder is low.
Yeah.
So you're even your way your shirt. Carl, you see that? His shirt stays real close to him here. These are avoidances. So this tells me, to me, it's like, of course there's going to be shifting. I had an injury, Ed, and then nobody brought me back home, so my body had to.
Right.
There we go.
Yeah.
I can survive here.
Yeah.
It's not your fault, but to live to 90, we can't stay in this crooked position.
I don't know how to get to 50.
It's okay. Well, we got to get you back to curving your neck, ear over your shoulder. I'm gonna look at you here. You're fine. So we're dealing with about 2 inches from your ear hole to the center of your shoulder. The more forward, head weighs about 10 pounds. Maybe this is what they were illustrating you. Head weighs about 10 pounds. Every inch the head goes forward, the muscles double their workload and the discs. So 10, 20, 40.
Right.
A joint that's doing 4 times what it's supposed to be doing is going to try to be 4 times the size. It's saying, I have to. And so how do you stop bone spurs from growing? Well, you stop the reason for why it's happening. It's happening because his head's forward. That's why you see elderly people.
Yes.
That's because you can get away with it for a long time, for decades. And that is a solution and that's to me what a lot of therapy is just feeding. See, if I feed your avoidance, you might like me, right? You helped me. Well, not really. I just kept pushing the problem into a less sensitive area, taking weight off the things that do have feeling, and that's where you can get a little bit in trouble, because now the more weight you put on the disc, the more it compresses, the more you have to go farther forward. You're upright. Your muscles are supposed to be, soft.
Yes.
There's no contraction, right?
Right.
Now watch, when I bend forward, feel how I got tight?
Yep.
Right? Because
Totally.
if they don't get tight, I fall over, right?
Right.
Now when I come back upright,
Right.
they go back to being relaxed again.
Right.
Right?
Yeah.
So people are like, oh, I have tension in my back. Well, the tension is just there because your body's forward.
Yeah.
Because you're avoiding an injury that you had and then you healed wrong.
Yeah.
That we're going to discover in a minute when I start pushing on things and seeing where, oh boy,
Yeah.
that's been injured a long time ago and I've been avoiding it,
Yeah.
and we have to go in. It's time to discover it. Take a deep breath in for me. We'll sit up, and then let all the way back. Here we go. I got you. Wow, we got work to do. Yeah. Breathe in. Head back. Just relax. All right, deep breath in. Just 2 bones so far. Exhale. Let it go. All right. Wow, that was 3 vertebrae we got out of 12, right? So you have a 12-cylinder Lamborghini engine, and only 3 cylinders are actually firing. 9 vertebrae are just, comatose.
Yeah.
They're not responding. We need to get has anybody ever done that before? That adjustment particularly?
Not that one.
Not that way?
In particular. I mean, the physiotherapist was really good when you do different things to crack, and he had trouble.
I'm saying if somebody did that and was happy, we got problems.
Yeah.
You understand? Because that was far from where we should be. Like, in a minute we'll have shirt off and I'm going to be digging, because the soft tissue work is to make the next time I adjust you better.
Yeah.
Needs improvement, because if this area is locked, that's also what's overworking your lower neck. There you go. All right, there we go. They're working. Oh yeah, that's after me, does it? All right, face that for me, okay, good. Yeah, we got to, don't let anybody touch your lower neck. Leave this, nobody needs to be putting pressure on your lower neck. That's where all surgery, 99% of surgery, C5, 6, and 7.
Yeah.
Okay? Just pure statistically.
Yeah.
Right? Not from me, not from chiropractors. This is from the surgeons. Where are people being operated on? The vertebrae being operated on 99% of the time are C5, 6, and 7, and lumbar 4 and 5 in the lower back.
Right.
Okay, the current medical and chiropractic explanation for this is age and weight. You're old and fat.
Yeah.
How old are the other vertebrae in the spinal column? They're all the same age.
Right.
So to say that it's aging is nonsense. It's alignment. The tire's the same age, but if the alignment's off, certain parts of the alignment, parts of the tread are under more stress.
Right.
Okay? We get it with our teeth. If you don't have a good alignment, you go to an orthodontist, or your tires in your car. So your spinal alignment determines where the stresses are going. Does that make sense?
Yep.
So it's not weight either, because how much the upper back's holding more weight than your lower neck.
Right.
So why are the discs in your upper back not injured and the ones in the lower neck are?
Right.
Aren't the ones in your chest holding more weight? Well, they're not moving. And so we don't age the teeth that we don't chew on. The football players that spend their whole season on the bench never get concussion. Right? Only the ones that are in the game are the ones getting injured.
Yeah.
The ones on the field. All right, real gentle. I got you, bud. I got you. Just this top. There you go. All right. Okay?
Yeah.
All right, very good. I got you. There we have it. I got you. There we go. Good. Okay. There we go. All right, there. Oh, that's gotta. Should be able to, Ed, is that all you got? There shouldn't be any tenderness. There is no normal soreness up here.
No.
Well, that's my point. You understand? There shouldn't be anything.
Yeah.
Any restriction or tenderness is injury.
Yes.
And life. Put it in there.
Yeah.
The neck belongs back here, and we'll show you at the end of our visit. There's a device called a Denerol. So it's a neck orthotic which holds you in this curved position.
Right.
And that's what's going to be essentially like a toothbrush that you'll utilize end of the day. These are the roots of your neck here. They just get tugged on.
Yeah.
The more forward your head goes.
Strange pain.
Mm-hmm. Was that?
Was that hyperextension 19?
I'd be hyperflexion. So a deep flexion would set you up for this. Correct.
Yeah.
So there's two things that you injured there, really. You injured the disc. So where the disc contacts the bone is what we call the end plate. So there's that piece of cushion that's sandwiched between bone.
Right.
Where that disc contacts the bone is called the end plate of the vertebrae, so the vertebral body end plate. When you compress a healthy spine at 19 years old, the disc actually doesn't get injured. It cracks the end plate.
Right.
The bone gets injured by the disc. The bone releases an acid over a period of 10 to 15 years, which then liquefies and damages the disc. So it took that from 19 to 35, the disc was being, like a cavity was growing. You understand?
Right.
So the injury at 19 allowed that process to start. The injury to the backside was the fabric I tried to show with that blue towel.
Yes.
That made it easier for the disc to stay compressed all the time, and injury to the joint. See, joints replace. I don't cry about joints because they are on a cycle of healing.
Right.
Discs do not replace.
Right.
They don't heal. They can be repositioned. They can be rehydrated. I love Sensodyne, the toothpaste company, because they're always very, very careful to not say regenerates your enamel.
Right.
Because that's not possible, right? Restores, renews,
Yeah.
They love. We want to say something, but we can't say regrows your enamel, right? Because that's not possible.
Right.
There is no making new enamel.
Right.
Right. You have the enamel when you're born, and then you lose it.
Right.
But we can take whatever paint that you have on your car and make it look. We can polish it, right? But we can't make new paint.
Right.
So there is no making new discs, and people love saying words that are really close to that to me.
Yeah.
Well, we're gonna fix your discs. Like what? Fix what?
Yeah.
If he's got a herniation, we can put the material back inside, but the way that it got out can't be sealed.
Yeah.
Do you understand?
Yeah.
So how do we get the disc to not be outside? Well, keep the pressure off the front part of the disc, and it won't venture out anymore.
Right.
But but the exit that the acid created took 10 to 15 years to open up. That exit's still going to be there.
Sure. Yeah.
You've burrowed a hole out. So the disc has a nucleus made up of two materials. A nucleus that's wrapped in all these layers called the annulus. Think of like a present, like there's like one of those gag gifts. You take a present, you wrap it in wrapping paper, then you wrap it again, then you wrap it again, right? And then you're like ripping the wrapping paper off. You're like, how many layers of wrapping paper are on this present? Right. Anyway, that's the analogy for the disc. It's been wrapped in wrapping paper, and when the disc becomes acidic, it cooks its way through those layers.
Yeah.
So a bulging disc means some of those layers have been cooked through.
I see.
A herniated disc means all the layers have been cooked through, and now the nucleus is outside of the outer annulus. Right. The outside has now been penetrating. So, let's not. That disc material is not on a cycle of replacement. See if I can get a little more. Okay, good. Just checking. A little bit. Yeah, there we go. Left side is all elevated. Injury here, and then avoidance. And now you're going to abuse. Do you get the idea?
Yep.
The opposite lower is going to be overworked because you're in left avoidance, right hypermobility, left hypermobility.
Right.
So where should we work? Should I go down here and beat up? No.
Right.
Let's work on the source. I mean, the peak is right there. I feel like sometimes, I've been palpating. I wake up in the morning, I palpate people. I work on people when I go to bed for like the last 15 years. And so it becomes extremely obvious to me. I always wonder how maybe it's not as obvious to everybody else because it's like even small imperfections I can feel. My favorite analogy is, at the Lamborghini factory, I watch the mega factories on how they build these, $500,000 cars, and they talk about the laser precision and how everything's like, high technology, made to the 0.1 micron, But before the car can leave the factory, they have to have somebody run their hands over the panels of the car to feel for imperfections. Why isn't that redundant, right? But because even Lamborghini realizes that there's something about palpation right, that can detect things that their lasers and their
Right.
technology can't. Why is that job even there?
Right.
This guy's got to run his hands all over the car, you know, and that's so you can feel it. The palpatory sense is one of them. Like I said, we can't emulate it. Otherwise, they would emulate it with some sort of laser. they would fire that guy, and no. We can detect all imperfections now with this computer model.
Good job, security.
Right? Yeah. Right. I'm just saying, it's just, they haven't been able to copy the brilliance of palpation yet, and it's very obvious right here. Gee whiz. Okay. So this is actually the healthiest part of your back.
Yeah.
That's actually the part of your back that works. Right? This is the bad part, so they have it inverted.
Right.
They say this is the bad part of your back. I go, no, that's the good part. That's the part that works. This is the bad part.
Yeah, that makes sense.
And they'll refer to your middle back, at least many radiologists will, if they take a spinal MRI, they'll look at an area that hasn't aged and refer to it as unremarkable. It isn't unremarkable that something's not aging.
Right.
That's actually remarkable that it didn't get worn out.
Yes.
Why isn't it wearing out? If you had I had a patient 70 years old, his spine still, in certain areas, looked like 20 still. They said, unremarkable. I'm like, no. His hair still doesn't look like, his skin, his vision, his knees,
Right.
Other parts of his body aged, but why did this part inside not age?
Right.
And they say, nothing to see here. I'm like, no, that's everything. That's actually everything.
Yes.
And if you can't explain why that hasn't aged, you'll never understand why this is aged.
Right. Well, that's why the ruler on the back.
That's right.
But I focus where it hurts.
Right. Well, that's why I get paid the big bucks. Right? Because you're just making it worse.
Yeah.
Right? You're just making the parts that are overworked
Yes.
work a little more. Now, mechanically, when you stimulate the mechanical receptors in the body, they inhibit the nociceptors. This is why when you bumped your elbow as a kid, you immediately rubbed it because it felt better.
Right.
Right? So you whack something, then pain receptors are going off, and you rub it, and you stimulate the mechanical receptors, and that in the spinal cord. It's actually a spinal cord reflex that happens where you're inhibiting. Doesn't involve the brain. My point. It goes into the spinal cord, and you block the pain sensation at the level where the nerve comes into the spine. So if I'm going too hard, just let me know.
Oh, it's good.
You're doing great. There we go. It's pretty boring. I just gotta sit here and rub for half hour trying to do my song and dance and distract you, but hello my honey, hello my baby, hello my ragtime gal. Send me a kiss by wire. Baby, my heart's on fire. If you refuse me, honey, you lose me, and then I will be left alone. Oh, baby, telephone, tell me I'm your own. My wife's like, really, Ed? Really, Ed? You remember? That's from the Warner Brothers Frog, right?
That's right.
Remember that skit where the frog comes out
Yeah.
and he's trying to convince everybody that he's got a dancing frog? What? Feel that kind of gristle in there? I mean, right next to the scar. There's a block, because this all drains towards the spinal column.
Right.
So right medial to his scar, there's a large blockage. Just total coincidence. Or the cause. Right there.
Yeah.
Feel that? I'm not sure you're almost going to hear it. I probably can't hear it, but it's got like a little crunch right there. You can feel it, but it's like there's the part of the injury was in here, and that shut off the circulation. Yeah, you're just over recruiting this area. Now this area gets all inflamed.
Yeah.
You're using your thoracic cage to assist.
I used to do a lot of weightlifting, but I've stopped everything.
Mm-hmm.
I don't know where the problem is.
Wow, that is a monster.
I dealt with the physical pain for a while, but now it's mental now.
Oh.
Sure. Well, if you have pain for too long, it starts to.
It's
It's normal. It's not. You're nothing wrong with you. It just beats you down psychologically.
Yeah.
Yeah. yeah, it's coming out. It's pouring out right here. This is pretty bad over here. That can go like the bloopers. Hello, Mom.
Oh no, I'm gonna put that in the little video.
Yeah.
That's gonna go in.
Make them laugh. Make them laugh. You know, it's a lot. Laughter is one of the greatest medicines. I mean,
It is.
it has to. We call them the 3 T's in chiropractic. We call it thoughts, traumas, toxins. So all of them have an equal input on your health as a human, right? And I know on 90% of my visits, I'm thinking, traumas and toxins. Does that make sense?
Yeah.
Injuries, and then lactic acid. I used to overvalue, I believe I did as a doctor, I overplayed and overvalued for, I would say, a good decade of my, maybe 5-10 years of my practice, that those were more important. You understand? That those were the real areas that were that were creating my patients' problems. And thoughts were just like this third category of like, but it's mostly traumas and toxins, right? And I've come to be humbled that actually it's an equal triangle. It's 33, 33, 33, okay?
Yeah.
That the loss of a loved one is as impactful as a car accident. You understand? As impactful as being an alcoholic or whatever. They all have an equal input on the health of your body.
Yeah.
And you have to deal with the mind.
Yeah.
And the mind's ability to greatly influence your health. For instance, an easy way is, when you're stressed out, your cortisol levels are high. And if your cortisol levels are high, your body never goes into real healing.
Right.
So it doesn't matter how much I rub your back or how much I teach about dental rolls. If you're stressed out at work, none of it works.
Yeah.
Right? If you're not sleeping well, if you don't have a good circadian rhythm, if you're stressed out and you simply can't turn your mind off and I've just seen that too often now over the last 15 years that you have to deal with the mental component. There we go. Yeah, like right there.
Yeah, and these areas, this has inflamed in the last 2 years. And deep, and it's.
These are stabilization areas. These are stabilization muscles. So the lower back gets injured. The areas above and below the lower back are responsible. So when we have falls or injuries, this joint down here gets locked up.
Yes.
It is an accomplice in this, let's say injury to your lower back. Yeah, right there. More coming out. All right. Okay. Yeah. I mean, that's right next to that scar. There's a scar.
Right.
Look at this giant mound of crud that's in there in the middle of this.
Wow.
We gotta get all that out of there.
Yeah, and those are the capillaries that all the blood coming out.
It's lactic acid. It's internal. The mark only comes out where there's something trapped inside. And as a patient progresses through care, it just becomes pink. You don't see that dark reddening. That's the first 5 visits primarily. There we go. There we go. Sorry, here we go. There we go. Breathe. Come on. Deep breath in. Exhale, relax. Relax, I got you. There you go. Okay, all right. You okay?
Yep.
Yeah, that's, see the direction we're going?
Yep.
That's gotta go in. We got
Yep.
breathe. Okay. We're early, but get the idea, that's where we're going.
Yes, yeah.
You gotta overcorrect backwards. I got you, Lee, I got you. Good. There we go. Go ahead and tilt your left. There we go. Go ahead and tilt left. Good. There we go. All right, go ahead and tilt right. There we go, yeah. Go ahead and tilt to the left, all right. Okay, good, all right, gotcha. So as high as you can on your neck, take your hand, and then you'll place it on your forehead, and you press your head into it. Does that make sense?
Yeah.
And then see if it'll stay there, and then you put your hand on your belly and relax. Does that make sense?
Yeah.
And you just want to let your head, and then if it's not too uncomfortable, legs straight. If it's too uncomfortable, you keep bent, but ideally the legs are straight. Does that make sense?
Yeah.
And 20 minutes.
Yeah.
It's molding. This is evening time, half hour before you go to bed. You're
Right.
putting your body back into an upright position. So we got to work on getting that curve back into your neck.
Right.
That's what we will say permanently changes the firing order. Otherwise, you initiate motion with your lower neck and you're not initiating the motion with your upper neck. The adjustments on the table, if you go a couple weeks without being adjusted, it might not feel like it's feeling right now, or it's not that effective because your back gets too stiff.
Right.
So this device is specifically tailored for active treatment.
Yes.
You know, you don't go more than a month without adjustment, or you use that other device you're talking about, or some other way that's more mild. You understand?
Right.
If you're going to use the Deneral orthotic, it's meant to be used with chiropractic care, so that we're going to a deeper level. It's a little bit more targeted.
Right, right.
Arms up, knees bent. Let's see if I can take this one. Yeah, okay, good for one. And then about every minute, you're going to roll upwards. So you're going to roll this way.
I see.
And then knees together, feet together, knees left. Stretch your knees left. Up, so you rotate. There you go. There you go. Breathe, exhale. And bring knees back up. About 5-10 seconds each way.
Okay.
Knees right. Breathe in, exhale.
Excellent.
Thank you. Pleasure.
I am very grateful.
I appreciate it.
Very grateful.
Thanks for letting me. Thanks for coming in.
Yeah,
Like I
thank
said, this is
you.
yours.
You did great.
Thank you very much.
Thank
Yeah.
you.